morning, everyone. We'll be getting started here in about 30 seconds and giving a few more people some time to join. We will make sure. Good morning, Carolyn. Thank you. You're already getting a jump on what we'll take everyone through using that wonderful chat feature. I'm actually going to have several screens, but I'm going to share with you what I see for a second. Everyone should see on their screen my little notations. I just want to acclimate you to taking a look at the chat features, and you'll see where we have notes that are going to be helpful to you as we go through this meeting. I'll do that again in a couple seconds as well, but that'll be how you can communicate with me. In the chat feature, you'll note that we have muted all participants for today's meeting just to ensure that we're respectful of everyone's time. However, you will be able to communicate with myself as well as Nicoletta Torres within the chat function of the Teams meeting. All right. And Melissa, I see you also have joined, as well as a number of other employees of Krapf. All right. Good morning. Melissa, are you okay if I get started? Perfect. All right. So I will welcome everyone to today's open enrollment meeting. This is the first of actually 6 meetings that we'll have for 2022. My name is Shamila McLean. I am a member of the Innovative Benefit Planning Consulting team. We're actually the brokerage firm that partners with Krapf. We help with things like benefit negotiations, development of strategy. We're also advocates for you as employees of Krapf with the insurance company. So if you take nothing else away, just remember, we are not the insurance company. We stand right beside you in helping things to get done. So we encourage you to contact us. Our job, again, is to really find the best plan package for the best rate possible. That said, I am pleased to welcome you to the 2022 open enrollment meeting. And as I move through this presentation, there's going to be a lot of information, but don't worry, you don't need to write any of it down. If you take a look again in the chat feature, you'll see I've posted your URL or your link to the benefits portal. It's krafbenefits.com. Please also be aware you'll see a notation in the chat that everyone, again, is muted throughout today's presentation, but you will be able to communicate with me through the chat functionality, as well as a Q&A session that we'll have at the end of the presentation. We encourage you to pose your questions in that chat feature, especially questions that everyone will be able to benefit from. If you do have a personal question, I would just encourage you to reach out to the benefit guardian that is posted in the chat as well. And I'll just slide that over so that you can see. Mary Gannon is your benefit guardian, and think of her as, customer service, if you will, but not the insurance company. Her phone number as well as her email are there, and she is ready to take your questions and your calls. Great. I'm going to go ahead and proceed through the slides. And really, before we dive in, I just want everyone to know that this was a very thoughtful process that took place before we arrived at this year's benefit program for the 2022-2023 plan year. It really was reviewed at length, the cost across all plans, but particularly the Independence Blue Cross medical plan and each contribution tier. Really faced with rising costs, as we're all aware, we see it at the gas pump, we see it in the grocery store. We are happy to report that Krapf, together with Innovative, we were successful in being able to keep health plan costs within reason for everyone this year. The logical question is, as we talk about costs, this slide presentation will go through plan benefits. If you wish to see costs, we encourage everyone to really access that portal that's posted in the chat, where you will also be able to log into UKG as well as Benetrack, which are your payroll portals, which is where you'll find all costs and contributions. Let's talk a little bit about some highlights for 2022, what's changing, what's new. Those are like the #1 things, of course, anyone wants to know. For 2022, this portal that we keep talking about, we're happy to introduce the Krapf Benefits Portal, which is where all things benefits can be found. Again, we'll tell you right off the bat, Independence Blue Cross will be remaining as your major medical carrier. That's what I would want to know, is my health insurance carrier changing? It is not. Also, the Reliance Standard Voluntary Long-Term Disability Plan, that will be discontinued effective January 1, 2022. And I'll just pause there to share with you a little bit about the why there. That plan was actually discontinued in the best interest of employees. It was found that that policy requires a very specific number of hours worked in order to claim benefits for long-term disability. So you would have employees that would have the program and paying into it on a voluntary basis, but then at the time of claim, if you didn't have the proper number of hours, the insurance company was giving a hard time. And so we certainly don't want you to have a benefit that you can't use, although you're paying for it. And so that plan was discontinued effective January 1, 2022. Additionally, in terms of what's new, you'll see a lot of mention about the Benefit Guardian Service. Innovative Benefit Guardian Service will replace guardian nurses. And of course, you would reach out to us as opposed to grants. New York Life, your voluntary life plan, you might notice Cigna is now more robust. So we'll dive into that. And we're also going to be offering a one-time open enrollment, or OE, opportunity to enroll in voluntary life without any medical evidence of insurability, up to what's referred to as guaranteed issue. So lots of medical or insurance terms. We'll explain all of those in future slides. Other than that, all other insurance carriers and plan designs will remain unchanged. So what is this portal that we keep talking about? That portal is located online at the link that you see on your screen. The website is one-click access, again, for all things benefits. Think of it as a hub for everything that you would need to know, from where's a form to what is the copay to how much is the deductible. All those things are housed on that website. Should you have any questions or need help, again, we encourage you to reach out to the Benefit Guardian, who can assist you in navigating the site. Talk a little bit also about eligibility, just high level. We've indicated here the number of hours you have to work per week to be eligible for the benefits that we'll cover in today's presentation. And that grid is there to illustrate that for you. But, of course, I'm going to keep saying it. You can find it on the Krapf Benefits portal as well. Also, this comes up many times, who's eligible for my dependents. And so we just want to lay that out for you here, as well as on the portal, that legal spouses are eligible, as well as your children, up to the age of 26. And so as long as your child is under the age of 26, they can be covered under your benefit program. Changes during the year, we have noted, of course, this is open enrollment. So you kind of think of it as your time to enter the program, and you would be right. It's your one time during the year that you can make changes under your health plan, your dental plan, your vision plan, unless you have qualified life event changes during the year, such as a marriage, a birth, or a divorce, those sorts of things. And you can change your dependent tiers according to the life event that you experience. However, life insurance, voluntary life insurance, works a little bit differently. Voluntary life insurance, you can enter the program on a quarterly basis. And on a quarterly basis, you'll see noted here, you can enroll in November, February, May, and August. And if you do experience any qualified life event changes in for other benefits like medical insurance or dental insurance, we encourage you please to reach out to Human Resources at the link noted here, the email. And then, of course, we're talking to all active employees at this time, but just be aware that upon termination of employment, all coverages end as of your last date worked. We just want to make sure that that is clear. So other coverage. Many times, we'll talk about medical insurance that Krapf offers, dental and vision insurance, but we just want to make sure you're also thinking through other options that are available to you. These choices are completely up to you, whether you choose to go to the marketplace, which is healthcare.gov, Medicare, if you're eligible, Medicaid or CHIP is another way of thinking about it, or even veterans insurance. We just want to provide you the resources to make the most informed decision possible for yourself and your family. And as questions come in through the chat, we'll make sure that we answer those, and we'll do a Q&A at the end. But if Nicoletta is able to answer them during the meeting, she will do so. And if not, we will circle back to you. Just wanted to make sure I acknowledge that question. It's a great way to kind of talk through that for others as well. So let's dive in, talk about your medical benefits. Krapf offers a choice between 4 medical programs. All of them are administered by Independence Blue Cross. As you take a look at the plans, the good news is they're all PPO plans or personal choice options. How to think about which one you wish to choose, just high level. The high plan has the highest premium or the most out of your payroll. However, you would pay the least out of your pocket as well because the deductible is lower than all the other programs. The PPO low plan has a lower deductible than the high deductible health plan, but it is, more costly because of that than the high deductible health plan. As you note, the HDHP designation, this stands for high deductible health plan. There are 2 with Krapf, one with an HRA. The HRA is a health reimbursement account that's funded by Krapf for you, and we'll take a look at how much is funded. And there's the high deductible health plan with an HSA or a health savings account, which is a banking component that if you choose to participate, is funded by you as the employee. And so let's take a look at comparing your medical options. So this chart, and I won't take you through line item by line item, also available at krapfbenefits.com, but high level, really try to show you how to think about it from a cost perspective. So most expensive plan is the PPO high plan. The next expensive would be the low, and you can really see the reasons. The annual deductible on the PPO high plan is the lowest, and then down the line, it would be the PPO low plan. Third in line is the high deductible health plan with HRA, and that's because, again, there's a little notation. Krapf funds this HRA for you in the amount of $1,500 for single individuals and $3,000 for anyone enrolled with what's called family coverage, which is even if you have one dependent, from an HRA perspective, you have family coverage. It's anyone more than yourself, whether it's yourself and a spouse or yourself and several dependents. And then, of course, the HSA account as well. Now, we've taken a look at, on this slide, the in-network benefits. You also have out-of-network benefits. These are PPO plans, so there are out-of-network coverages. If you do choose to use out-of-network benefits, just keep in mind that when you go out-of-network, it means the doctors, the facilities, the hospitals that you're seeing have no agreement with Independence Blue Cross. So the plan will outline what it will cover, the deductible, the out-of-pocket maximum, the co-insurance, how much will you pay in a deductible, what's your maximum exposure as an individual or family, and then once you hit your deductible, how much you pay, which is 50%. The issue is the non-network provider can charge you balance bills. So they may not want to accept this payment in full and likely will not what they receive from the insurance company. So we just want to make sure that you're aware of that. You do save money by using in-network providers. And so there's a notation here on how you can locate in-network providers within the Independence Blue Cross network. Even though you don't have to choose a doctor with a PPO plan, it's still good to know how to find a doctor within the PPO network. Your plans with Independence Blue Cross also include prescription coverage. Your prescription benefits is different depending on the plan that you choose. So the PPO high plan, there are co-payments associated with the prescription costs, either $20 for the generic, $40 for the brand, $60 for the non-formulary, or the most expensive tier noted here. And if you choose the PPO low plan, the co-pays are the same, but there's a deductible associated with the prescription. So before you pay your co-pays, you would pay this $250 deductible under the PPO low plan, and then your co-pays would kick in. Under the high deductible health plan, you might recall, there are deductibles associated with this plan, $6,350 for a single, for example. The prescription by law is integrated with the high deductible health plan deductible because you have to have first dollar benefits only under copay plans. So when you have a deductible plan, the deductible must apply to everything, including the prescriptions. The IRS mandates that it be that way. So you can also save money regardless of which plan that you're on if you choose to enroll in mail order. So if you know that you're taking what's called a maintenance medication, that's a drug you take every single day, not one that's only for like 10 days at a time, but really ongoing. Maybe it's a cholesterol medication or a birth control pill. whatever the case might be, why not mail in the prescription and get a 90-day supply but only pay 2 copays versus going to the pharmacy 3 times and paying 3 copays for the same amount of the medication? And so that's a choice that you can make, but we just want to make sure that you're aware that you have that choice. Now, there's a lot of information on this slide. I promise you I will take you through it step by step because we use, alphabet soup all the time. HSA, what's an HSA? So we want to give you an overview of a health savings account and how it works with the Krapf high deductible health plan. All too often, it's confused that a high deductible health plan is an HSA. They are separate and distinct. The high deductible health plan is the medical component of your program, and that's managed by Independence Blue Cross. The HSA is a bank account that, as an employee, you have a choice whether to participate in. The health savings account can be tied to the high deductible health plan to help pay for the deductible that you would have as a responsibility under that plan. If you chose to participate in 2022, you're allowed to set aside pre-tax contributions that would come out of your paycheck up to $3,650. That is what the IRS sets for individuals. If you enroll with anyone more than yourself, again, you have a family plan, you can fund up to $7,300. That's how much the IRS allows you to put into the account. It should be noted, this is not like a flexible spending account. Many times people go, I don't want to participate, it's use it or lose it. A health savings account belongs to you. Those are your dollars. They're 100% portable. Even if you were to leave Krapf, those dollars belong to you, and you could use them for retirement if you so desired. Who's eligible for this particular plan? Very important to note that you're eligible to open an HSA if the following parameters are met. Number one, you have to be covered by the high deductible health plan. Again, that is an IRS requirement. You cannot have a health savings account without a high deductible health plan. You also can't be covered by any other insurance that is not a high deductible health plan. Sometimes we tend to cover ourselves where we work, and then maybe our spouse works somewhere else and we cover ourselves there. That would render you ineligible to have and fund a high deductible health plan with an HSA. So the problem with that is Krapf won't know if you are covered under a spouse's plan, or maybe you have another job elsewhere and you're covering yourself under a non-high deductible health plan. If that's the case, you really create a tax issue for yourself. And we just want to make sure you're aware of that. Again, that regulation about not being covered under other health insurance is an IRS rule. You also can't be enrolled in a flexible spending account unless it's a limited purpose, and we'll talk about that, nor could you be covered under an HRA. There are also rules about not being covered under Medicare, VA benefits, and not being able to be claimed as a person on someone else's tax return. The best way to think about this, the rule of thumb, this is a tax-advantaged account. The government does not want to give you tax advantages to be able to save pre-tax on dollars that come out of your own paycheck and then allow you to double down and save under other benefits the government either offers, like Medicare, or other tax-advantaged accounts like an HRA, for example. How it works is listed here for your notes, how you can go about using the card. Also a note about what qualifies as an expense that can be funded with your HSA card. It also includes over-the-counter medicines or OTC medicines and copays and deductibles that you have under your plan. This is the other acronym that we mentioned that can be paired with the high deductible health plan. The high deductible health plan, the benefits that Independence Blue Cross is the same, but the HRA is a little different. Outside of the HRA is funded by Krapf. So they put dollars into an account for you if you were to enroll in the high deductible health plan with an HRA to pay the first $1,500 of your medical expenses, your qualified in-network medical expenses. If you enroll with anyone more than yourself, Krapf will pay the first $3,000. And then, of course, your deductible is higher than those amounts, and so you would be responsible for the remaining balances. There's a notation around the time frame that you have to utilize those funds, as well as the frequently asked questions around, can I have this account with that account? For an HRA, you can have both. However, you can't submit the same expenses, again, because they're both tax-advantaged accounts. That's double dipping. The IRS doesn't allow that. You also cannot use your HRA for claims that are out of network. Krapf's HRA account is specifically for in-network expenses. And then again, same notations about how you can utilize the plan as well as what you can submit claims for. If you do choose to enroll, by the way, in the high deductible health plan with the HRA, you'll be automatically enrolled in this account. The HSA is a choice. This account, because it's funded for you, will be open for you should you choose the HDHP plan with the HRA. And this is just a little bit of a graphic, if you will, about how you can go about submitting your expenses, whether they're medical expenses or prescription expenses. The great news is you have a benefit guardian here. You can contact iSolved if you have questions, of course, because they're going to issue you the card that pays HSA or HRA expenses. But you also have Mary Gannon should you have any questions, and you can also learn about this on the Krapf portal. Some employees may not necessarily be enrolled in the Independence Blue Cross plan, but you might be enrolled in the Key Benefit Administrators plan. This plan is called Minimum Essential Coverage. In a nutshell, it covers preventative services only. There is no prescription coverage. There is no coverage for anything outside of what the government deems preventative and wellness. And so there's a little thing here noted at this link at healthcare.gov about what a preventative benefit would be from a government standpoint, and those services would be available to you at 100% coverage. As of January 1, 2022, there used to be, an out-of-network and an in-network. Key benefit administrators, all benefits are available at the in-network level at 100%. Question, of course, you may have is, why would I choose this plan over the Independence Blue Cross plan? Once you log into UKG or to Benetrack, what you'll note is that this plan is even less expensive than the high deductible health plan with HSA. It also is intended to help you fulfill the individual mandate if you happen to be in a state that has one. So if you're in New Jersey has its own, individual mandate or requirement to have health insurance. And if you don't have health insurance, they charge a tax. And so you can help yourselves with that tax by having at least this coverage as opposed to going there with no coverage. And so that's the intent, to help you with those situations. Let's talk a little bit about Teladoc. There was an eligibility chart we reviewed a few slides back that would discuss all the benefits you're eligible for depending on how many hours you work. Good news is all employees are eligible for Teladoc, and we just want to make sure that you're aware of that and that it's being utilized. All employees, as well as your dependents that dwell with you, even if you're not on the medical plan, are eligible for Teladoc. $0 copayment for any call that you make to them. Of course, if they prescribe you any medications for the conditions that you're calling about, you would be responsible for the prescription cost. However, there is no charge for making the telephone call, such as if you were to walk into your doctor's office and you had a copay. There is no copay for the interaction with the board-certified doctor. Teladoc doctors are available to you 24 hours a day, 7 days a week, all year round, and you're able to access them by phone or any other web-based video conferencing platform that you should choose. We discussed HSAs so far, health savings account, HRAs, health reimbursement accounts. Now let's speak a little bit about FSAs, or flexible spending accounts. Krapf actually offers 4, and we just want to make sure that we're crystal clear on the 4 accounts that are offered. I find the best way to do that is to lay it out in a chart. Lots of words that are very important at the top, but the chart tells all. What are the 4 accounts? There is a medical flexible spending account, or FSA. That account can be utilized for medical, dental, vision care expenses, and the most that you can fund into that account is $2,000 annually. But you could choose to fund as little as $100 annually. You should determine what your medical expenses, your out-of-pocket costs are going to be to know how much you want to put into that account. The limited purpose healthcare FSA, that is for those who choose to enroll in the high deductible health plan with an HSA. If you're in that account, you might recall no double dipping, but you could enroll in this particular type of FSA, this limited purpose healthcare FSA, because it should only reimburse dental and vision expenses. So you'll use your HSA dollars that you fund for medical expenses, deductible expenses, all those sorts of things, and then use a limited purpose FSA, should you desire to enroll in one, for any dental or vision expenses, so that you're not cross-accumulating in those accounts. The dependent care FSA, again, many people think about it just as that, just for daycare. But dependent care FSAs are not just for daycare. You can also use it for elder care expenses so that you or your spouse can work. We anticipate that, some may wonder, well, what does that qualify as, an elder for elder care? How do they get covered? There's a notation here that your dependent elder must live with you for at least 8 hours a day and be considered as your tax dependent, essentially. On your tax returns, they also have to be incapable of self-care. And so those are the requirements should you decide to submit for expenses for those accounts. If you do participate in these accounts, please be aware, the medical FSA, the limited purpose FSA, these accounts, whatever you elect, let's say you did elect $2,000 annually, your annual election is available to you day one. But please be assured that anything that you were to spend, call it January 1st, if you elected $2,000, if you spent $2,000 on January 1st, those dollars will be recuperated through future payroll deductions so that you're funding the amounts that you have elected and spent. The dependent care account and transit accounts, these accounts are available to you as you fund them. So if you took out $5,000 annually and you have, $192 coming out of your paycheck per pay, you're only going to be able to use how much you have available to you on a per pay basis. These dollars must accrue is the way the IRS has this set up. Also, let's talk a little bit about dental benefits with Delta. Delta is one of those companies, I tell people it's all about the advertising. Depending on what company, you've seen on the television or on the side of a bus, Delta is one of those companies that does a wonderful job at advertising, but also happens to be really, really good at the benefits that they offer. You have two dental plans available to you. They are both PPO plans, so you're not required to choose a dentist. One plan offers more benefits than the other in terms of how much you have to spend per year. So if you're going to enroll yourself and a spouse under the high plan, both of you would have access to $1,500 per year for qualified dental expenses, but you could not utilize each other's $1,500 per year for those expenses. There's also coverage for orthodontia. This is a lifetime maximum. So the amounts that are listed here, they don't renew just because it's open enrollment. If you utilized the orthodontia benefits or the braces coverage last year, then those benefits would become unavailable to you this year because it's a lifetime benefit that is tracked even if you were to switch insurance companies. You also have available to you two programs through VSP, two vision plans, same setup, where you can choose between a core plan or a buy-up option. How do you choose which plan? Depends on how much you think you're going to need in vision expenses. If you're like me, the glasses are my face. So I might have eyes that degrade annually, but I kind of also want frames annually. I want a new face every single year. And so I would choose, in my instance, in this example, the buy-up plan so that I could get frames every 12 months versus every 2 years, for example, with the Vision Core program. You'll find in general as well that the Vision program, the premiums are much, much lower than medical. So you'll likely also, if you wear glasses and intend to use the plan, choose the buy-up plan in any case. Now, we did mention at the outset that there is a shift, one of the things for 2022 to highlight in the robustness, if you will, of the life insurance program that's with New York Life, formerly known as Cigna. So what's new? What's different about this particular plan? For one, there's going to be a one-time open enrollment for those applying during the November 10th through November 24th timeframe. Let me see if I can help us out here. For whatever reason, on the other screen, you guys are having a hard time seeing this. Okay. And so for that particular plan, you are able to elect in increments as a single person, as an employee, of $10,000. However, you can choose the lesser of 5 times your salary or $500,000. So, for example, if you make $30,000 a year and you decide you want to purchase life insurance, you could purchase up to the lesser of 5 times your salary, which is 5 times $30,000 a year, $150,000. You could elect up to that amount in $10,000 increments. If you're a new hire and you're coming on for the first time, that's awesome because there is a guaranteed issue amount, a flat amount So you would be guaranteed the $100,000 based on how much salary you make and all those sorts of things. But at least you know, guaranteed issue, you don't have to answer medical questions at least up to the amount of $100,000. That's important because if you were to try to come onto the program outside of this one-time open enrollment that we were able to negotiate and have offered, and outside of being a new hire, you have to furnish medical questions for all amounts of life insurance. That's why this is a wonderful opportunity to come into the plan if you were never enrolled, or if you did enroll, but you chose less than the guaranteed issue amount, and you're eligible to elect more than what you have, you can do that without any medical evidence or proof of health. We encourage you to keep up your beneficiary information in UKG and Benetrack, and we encourage you to also apply for this benefit now if you think you're going to need it for the future. This way, you won't have to answer the medical questions. Same thing for your spouse or your children. Children never require medical questions, but your spouse and your child can't be enrolled unless you choose to enroll. And so this would be the time for you to come on as an individual so that you could secure coverage for your spouse if you chose later on. Similar to Teledoc, the Employee Assistance Program is a plan that's available to all employees, regardless of what category you fall into, how many hours worked, all those sorts of things. The EAP is completely confidential. We just want to make sure that you're aware of that. You could call in, talk about, legal consultation, child care solutions, simple wills. All of those things are available on their website. You should know if you've ever had to get a will, they're very expensive, but at the very least, if you take advantage of this program, you can access a simple will right from the Health Advocate tool. And so we just want to make sure that you're aware that this benefit is available to you. It's free of charge, and you can access information and flyers about how to obtain the simple will and all these other services, either by calling the phone number on the screen, emailing, and of course, I'm going to say it, accessing the benefits portal at krapfbenefits.com. Let's talk a little bit about enrollment. There's a screenshot. Of course, I'm obsessed with this website so that you can see what the portal looks like. We're going to encourage you to visit krapfbenefits.com where you'll be able to access your payroll system information based on your work location. Of course, you can still go straight through to UKG. They're rebranding as well, OT Pro. You'll be able to access logging in that way. And then Benetrack for Bernie employees to go ahead and log in and then make your elections for the current year. We're encouraging all really to take an opportunity to go into the system to ensure that your information is up to date, and then also, of course, to view contributions for the 2022 plan year. We mentioned Mary Gannon quite a few times during our presentation. We just want you to see who Mary Gannon actually is. We don't want to, make her obscure. This is the face behind the service that you'll receive when you reach out to our team. Mary can help you with anything from I can't find my ID card, the benefits are confusing, what did that girl say in open enrollment, I can't navigate the website, all those different things Mary is going to be able to assist you with. And of course, the question might be, well, what if I call and someone else is calling? No worries. That telephone number that you see, as well as the email from Mary, she has a whole team behind her to ensure that we reach each and every one of you and can circle back with the answers to your questions. And so we encourage you to reach out to her. As I mentioned at the outset, I am going to go ahead and now start taking a look at any questions that have come in. Nicoletta Torres is also joining me from the Innovative Benefits team. We thank her for that, and she has been diligently taking a look at your questions. We're going to go ahead and ask Nicoletta if you could field to me any questions that maybe have come in that you have not answered in the chat, and I'll be more than happy to answer those for the group. We also encourage those that are on right now to go ahead and pose any questions that you have in the chat. Just be aware that if you pose them in the chat that they can be seen by all, and we'll go ahead and answer your questions for you. Nicoletta?
Good morning, everybody. Yes, so far we don't have too many questions. Caroline asked about a 401k, so I did send her the flyer within the chat. So if you have any questions, reach out to the 401k administrator directly. And as of right now, nobody else has asked any benefits related questions. So we'll kind of hang out here for a few minutes and see if there's any questions that come up.
Okay. And we'll also encourage everyone just to remember, open enrollment is going to run from November 10th. So today's the 9th. We had a meeting even before, you'd be able to log in to the portal. We want to give some opportunity for you to digest this information, ask us any questions. But then open enrollment will run from 11/10 through November 24th to give ample time for you to make any choices that you wish to make for this year and to ask any questions if you do come up with any. Please don't feel, on the spot either. If you have any questions that you don't wish to pose in the chat in front of everyone, I will show you. Let me share my screen this way with you. If you take a look here, you'll see you have the main chat feature, which is what shows on the right when I click it. If you were to post something here, everyone will be able to see your question. But for example, if you wish to post something that no one else can see, and use Nicoletta as an example, if you were to right click her name and then go to chat, only Nicoletta will see that chat. And so if it was a personal question, that way you could pose it there if you didn't wish to reach out to Mary directly. Carolyn, I do see your question. I think there just might be a typo in the email address that you're using or the web address. So I'll just go ahead and repost that. Yeah, I live and breathe in that site, so I do know it should be working just fine for you, but you let me know if you run into any other issues for sure. Any other questions that you wish to pose in the chat, please go right ahead and we'll be happy to help you. If there's something that you wish for me to jump back to and explain more, happy to do that as well. You're more than welcome, Carolyn. Thank you. I'm sure someone else has the same exact question. Any that you can see maybe coming through personally, Nicoletta, that we could pose in a group way so that we don't, say anything that might be personal?
No questions yet. We have a quiet crew this morning, it seems.
It's early. I poured the coffee, but I didn't drink it either, guys. So, it happens. Well, in any event, we do thank everyone for joining. You should know that any questions that we receive either from this meeting or the meetings that we have subsequently will be turned into a frequently asked questions. The frequently asked questions will be provided to Human Resources, which I'm sure will circulate those. Nicoletta, I'm a crazy person, so I'm going to go ahead and post that survey link because I just realized how cool it was when I posted it that way. If you could, we would ask all to just take your opportunity to click into that link. You should see that in the chat. I just posted that for you. And in here in the chat, you'll be able to provide feedback about today's meeting. And we just encourage you to do that because it just helps us to get better. And we thank you for coming. I'll just hang out here in case any other questions come through. You're so welcome. Carolyn, it looks like you might still be having some trouble. If you could, let's see, if you could share with us contact information, we'll reach out to you right after. You're so welcome, Melissa. Wonderful. We will give you a call the moment I close this session.